wataendelea kupata matibabu na vile dawa ambazo zitawasaidia kikamilifu katika kuhakikisha kwamba wananchi
We have been getting some complaints about some people that we don't have some drugs in some of the hospitals, such as level 2, level 3, or level 4. I think we should be in a position to educate them that there are some drugs which cannot be supplied to level 2. For example, the cancer. The cancer patient cannot be treated in level 2. And then also in level 3. So we keep drugs according to where we get the patients. The patient is going to be treated. So there are some drugs we need to explain to the public that whenever they go, you know, somebody who is a cancer patient can go to level 2 or level 3 and start complaining that I was not treated, I didn't get the medicine. So medicine or the drugs are given according to the levels of the hospitals in our country.
Now we are doing Q4, what we are to flag off today. And we also want to confirm that the county has also been consistent in payments, and that is setting off the obligations that they have so that they can get the refills. Just also want to confirm that KEMSA, we are committed to do our supplies to the last mile, to the 40 health centers, 153 dispensaries, and 15 level 4 hospitals. And this is to the last mile, meaning before the week ends or before maybe the next week, every other hospital or every other dispensary will have received the commodities right on their doorstep.